Hello everyone and welcome. Today we're diving deep into a relatively rare but serious kidney disease called collapsing glomerulopathy. We'll explore what it is, what causes it, how it affects the kidneys, and what can be done about it. Understanding this condition is crucial for both medical professionals and anyone interested in kidney health. The causes of collapsing glomerulopathy are diverse, which makes pinpointing the exact reason challenging. One of the most recognized culprits is viral infections, particularly HIV, leading to HIV-associated nephropathy. Other viruses like parvovirus B19 and even COVID-19 have also been implicated in some cases. Genetic factors play a role, with certain gene mutations predisposing individuals to the condition. Additionally, drug toxicity, especially from medications like pomegranate, and certain autoimmune diseases can trigger the cascade of events that lead to collapsing glomerulopathy. In some instances, the cause remains unknown, classified as idiopathic collapsing glomerulopathy. Now, let's understand the pathophysiology. Collapsing glomerulopathy primarily targets the glomeruli, which are the kidney's filtering units. The hallmark of this disease is the collapse of the glomerular capillaries and the proliferation of podocytes, specialized cells that help filter blood. These podocytes undergo hypertrophy, meaning they enlarge and fill the Bowman's space, the area where filtered fluid collects. This process obstructs filtration, leading to a sharp decline in kidney function. The collapse is often accompanied by tubular injury, further exacerbating kidney damage and contributing to the rapid progression of kidney failure. Collapsing glomerulopathy is not a common disease. HIV-associated nephropathy was initially the most frequently identified cause. However, with advances in HIV treatment, its prevalence has decreased. The incidence varies depending on geographical location, genetic predisposition in certain populations, and the prevalence of associated infections like parvovirus B19. It is often seen more frequently in individuals of African descent. Due to its potential association with various underlying conditions, tracking its exact prevalence remains a challenge. The signs and symptoms of collapsing glomerulopathy can be quite noticeable and usually appear relatively quickly. The most prominent is a rapid onset of proteinuria, meaning large amounts of protein are found in the urine. This protein loss can lead to edema, or swelling, particularly in the legs, ankles, and around the eyes. Patients often experience a significant decline in kidney function, resulting in elevated creatinine levels in the blood. Fatigue, loss of appetite, and high blood pressure are also common, as the kidneys struggle to regulate fluid balance and waste removal. In severe cases, symptoms of kidney failure, such as nausea, vomiting, and shortness of breath, may develop. Diagnosis involves a combination of clinical evaluation and laboratory testing. A urine test to detect proteinuria is a key initial step. Blood tests, measuring creatinine and other kidney function indicators, help assess the severity of kidney damage. However, the definitive diagnosis requires a kidney biopsy. This involves taking a small sample of kidney tissue and examining it under a microscope to confirm the characteristic glomerular collapse and podocyte proliferation that define collapsing glomerulopathy. Genetic testing may also be performed to identify underlying genetic mutations. While collapsing glomerulopathy isn't typically categorized into distinct types, it's important to recognize the different underlying causes. We can classify it based on its etiology: HIV-associated, virus-associated, drug-induced, genetical-linked, or idiopathic, where no identifiable cause is found. Understanding the specific cause is critical for tailoring treatment strategies. Treatment and management of collapsing glomerulopathy are complex and depend heavily on the underlying cause. If it's HIV-associated, antiretroviral therapy is crucial. For other virus-related cases, antiviral medications may be considered. Immunosuppressive agents, such as corticosteroids, calcineurin inhibitors like cyclosporine or tacrolimus, and mycophenolate mofetil, are often used to suppress the immune system and reduce inflammation in the kidneys. Controlling blood pressure with ACE inhibitors or ARBs is also essential to protect kidney function. In severe cases, when kidney failure progresses, dialysis or kidney transplantation may be necessary. Supportive care, including dietary modifications and managing edema, plays a vital role in improving the patient's quality of life. Unfortunately, there are no specific preventative measures for collapsing glomerulopathy. However, managing risk factors and underlying conditions is paramount. This includes practicing safe sex to prevent HIV, avoiding nephrotoxic drugs whenever possible, and promptly treating infections. For individuals with a family history of kidney disease, genetic counseling and regular kidney screenings may be beneficial. The prognosis for collapsing glomerulopathy varies depending on the underlying cause, the severity of kidney damage at diagnosis, and the patient's response to treatment. Early diagnosis and prompt treatment improve the chances of slowing disease progression. However, Collapsing glomerulopathy can often lead to end-stage renal disease, requiring dialysis or kidney transplantation. Recent research is focusing on identifying novel therapeutic targets, such as specific signaling pathways involved in podocyte injury, and developing more targeted immunosuppressive therapies to improve outcomes. The exploration of genetic factors is also ongoing, with the hope of identifying individuals at risk and developing personalized treatment strategies. Thanks for joining us in this exploration of collapsing glomerulopathy.